After my operation, my incision itched, and I scratched it, and I kept scratching it. And that was a bad idea, because I wound up getting a pretty nasty infection from it. Took a lot of extra antibiotics and a lot of extra time before I started getting better.
You may think of a hospital as a very clean or even sterile environment. After all, you see people wearing gloves and other special clothing. But the fact is that even in the hospital, where special measures are taken to control and eliminate germs, they can still pose a threat. Infection control is one of the most important things that healthcare professionals and you can do to prevent germs from doing harm. Your doctors, nurses, and other caregivers at the hospital want you to know that they are taking every measure to ensure your safety while you are here. But you also play an important role. As a patient, you are a member of your healthcare team, and you can help prevent the spread of germs. Germs can make you sick. Your mother knew this when she asked you to wash your hands before dinner and after going to the bathroom. What you may not know is how these germs, including viruses and bacteria, are spread. It may be simpler than you think. Germs are spread from visibly dirty hands or from hands that haven't been washed in a while, from surfaces, food, or water that contain germs, from the droplets in a cough or a sneeze, and from a person's body fluids. Once you've been exposed to germs, they can enter your body very easily through your mouth, eyes, nose, or an open sore or cut. When you are sick, you are especially vulnerable to germs because your body is fighting to regain its health from illness or surgery. The good news is you can minimize your exposure to germs. Here are some ways to control and even eliminate germs from becoming a threat to your health. Assume that everyone you come in contact with has germs. You can't see germs, so there's no way of knowing where they are or who might be carrying them. So what can you do to lower your risk of coming in contact with infectious germs? Clean your hands. Hand washing is the single most important thing you can do to fight germs. Using soap and water or an instant hand sanitizer can help fight the germs that cause the common cold, the flu, or the spread of more serious disease-forming bacteria such as Streptococcus and Staphylococcus. Your caregivers understand how important clean hands are to your care. Before treating you, and sometimes even during your treatments, they will be washing their hands or using an instant hand sanitizer in order to prevent spreading germs from other patients, objects they have touched, or from themselves. If you don't see your caregiver wash their hands before caring for you, don't hesitate to ask them to do so. It's also important that family or friends who come to visit you wash their hands, especially before touching you. If you like, have a nurse explain the importance of infection control to them, or you yourself can remind them to wash their hands. The cleaner your environment remains, the better your chances for a speedy recovery. In fact, cleaning your hands should be a regular habit for everyone, in or out of the hospital. For your health and the health of others, clean your hands at the following times: before eating, cooking, or handling food, and after going to the bathroom, touching animals, including pets, coughing, sneezing, and blowing your nose. Cleaning the house, being outside, taking care of or visiting sick people, whenever hands look dirty, and if you haven't washed your hands in a while. Regular soap is fine for most hand washing, for example, when getting dirt off your hands or for regular bathing. Antibacterial soap should be used whenever touching areas known to carry a lot of germs, such as after using the bathroom. Use pump dispensers, as they are less likely to carry germs than bars of soap that don't drain well. Join us now as we look at the most effective way to wash your hands. Turn on the faucet and let water run at a lukewarm temperature. Wet your hands, then apply the soap. Lather up well and get the soap all over your hands, including the outside of your hands, between the fingers and under your nails. Wash for at least 10 to 15 seconds. That's long enough to sing happy birthday or say your ABCs. Rinse well to get all the soap residue off. Use paper towels or a clean towel to dry your hands completely, and turn the faucet off with the paper towel or towel. This keeps germs from the faucet handles from getting on your clean hands. Instant hand sanitizers are also a great way to keep hands clean and are very convenient for those times that you don't have access to soap and water. To use these products, apply a small amount, about the size of a quarter, to your hands. Next, rub it all over your hands, including the back of the hands, between the fingers and under the nails. Then, let it air dry. The second rule for preventing the spread of germs is to avoid contact with body fluids. There are many infections that can be spread by blood or other body fluids. Some of these illnesses, such as hepatitis B and C, HIV, and syphilis, are spread by blood and can be quite dangerous, even life-threatening. Other body fluids, such as urine, stool, vomit, or saliva, can be a source of bacteria or other infectious agents and may also cause serious infections. Sometimes there are special precautions that your caregivers must take to safeguard their health as well as yours when caring for you. One way is through the use of protective clothing. If, for example, your nurse or doctor is performing a procedure where there may be contact with your blood or body fluids, your caregiver may wear special clothing to protect their skin, eyes, mouth, and nose from exposure to these fluids. Gloves are worn whenever there's a chance that the hands will touch blood, body fluids, mucous membranes, wounds or surfaces, or items that have become contaminated by blood or body fluids. Masks, goggles, and gowns protect eyes, nose, mouth, and skin from droplets or splashes of blood or other body fluids. Some germs can be spread easily through droplets in a cough or a sneeze. Always cough or sneeze into a tissue whenever possible. If a healthcare professional suspects that you may be infected with tuberculosis, you will be asked to wear a protective mask that will keep you from spreading germs until you can be placed in a special room away from others. If a family member or friend is assisting you at home with activities such as caring for a wound, handling body fluids, drawing blood, or changing soiled sheets, be sure they wear protective equipment such as gloves. This protects them from being exposed to viruses or bacteria or spreading germs to themselves and others. But even when gloves are worn, hands should be washed afterwards. Next, keep surgical wounds clean and dry. Don't touch your wounds or surgical site with your fingers, and be sure to follow your physician's instructions for care. Be careful handling sharp objects. Your skin is your first line of defense against germs. If your care requires you to puncture your skin, for example, if you're a diabetic and need to inject yourself as part of your treatment, be sure to clean the area first with alcohol wipes and allow to air dry before breaking the skin. When you are finished with the lancet or syringe, be sure to dispose of needles correctly. Never throw a needle in the garbage or leave them out where you or others could be injured. Needles should always go into a rigid, puncture-proof container. Keep this container nearby and out of reach of children. Once home, remember to keep surfaces clean. In order to fight germs, countertops, tables, floors, and other surfaces should be cleaned with a bleach solution or suitable disinfectant regularly. If using a bleach solution, for best results, the solution should be made just before cleaning by adding a tablespoon of bleach to a quart of water. The bleach solution should have contact with the surface for at least 30 seconds. All disinfectant should be allowed to air dry for best results. To protect the skin, gloves should be worn while cleaning. Regular rubber gloves that are found in a grocery store are fine for this use. Next, keep your skin healthy. Healthy, intact skin is your first line of defense against germs. When skin becomes dry or cracked or irritated by frequent use of chemicals, it is harder to get rid of germs even with frequent hand washing. Therefore, keep hands moisturized with lotion. Lastly, regular bathing, eating a well-balanced diet, and getting plenty of rest will all help the immune system in fighting germs. Preventing and eliminating germs is important, not just in the hospital, but in your everyday life. Your caregivers will practice infection control in many ways while you are with us and encourage you to keep it up while you're recovering at home. Fighting germs will help you have a speedy recovery and help keep you and those around you from becoming sick.
Now that I know how important it is to keep your hands clean, I wash my hands more often. And I make sure anybody that cares for me, hey, they wash theirs too.